I would like to present about a skin disease called as Actinic Prurigo. So first of all, we would like to know about the organ related with this disease, which is the skin. So here, I already insert the anatomical structure of a skin. As you can see, it has three layers, which is epidermis, dermis, and a fat layer. So I also include the physiological function of skin. So some of it is our protection, excretion, and sensation. So protection, it was given by the epidermis, which we can see that it has a thick layer, and excretion was given by the sweat gland. They will excrete sweat, and lastly, the sensation was given by the uh, sensory neuron that located in the skin. So the next one is the cause of actinic prurigo. The first of all, each affected individual is exposed to long and short wave ultraviolet radiation, or called as UVA and UVB. Secondly, current research suggests that this disease may be an immunologically mediated genetic disease. So basically, actinic prurigo is a disease which people is very sensitive, are very sensitive with sunlight. When they exposed to sunlight, they will produce a red rash on their skin. So these are the symptoms: severe itching, painful inflammation of sun-exposed skin, lips become dry and sore or cheilitis, and lastly, eye strain, conjunctivitis. In this photo, I will also include the picture of people that infected by the actinic prurigo. And as you can see, all the symptoms can be shown in the picture. So the next one is the diagnosis. It generates a rash that looks like thicker scratch mark and regions with red inflammatory lumps. So you can see that all the thing I said can be found in the picture. And the next one is this disease also can be diagnosed also, using photo testing method. Photo testing method is a method that we use the we use a light that have a UV characteristic, and we expose it to the skin, but in a minimum amount, so that we can diagnose the disease. So the next one is the prevalence of this disease. The ratio of affection between female and male is 2 to 1. This can be proved inside the graph that I also included, which can we see that number of cases of female is very high compared to male. So the next one is the 60% to 70% of people got affected at the lip area. This is because lip area is the area that got the most exposed to the sunlight. Lastly, darker skinned individuals of Latin American and American Indian origin frequently experience this. So the next one is the treatment. Infected people can be treated by reducing sun exposure. It means that they need to wear a protective cloth to reduce their exposure of skin toward the sunlight. Next one is the emollients. Emollients is a moisturizing cream that keep our skin hydrated, so that when it's become dry, it will not uh make the red rash become too worse. So lastly, people need to consume vitamin D, because vitamin D has a characteristic that has a properties that good for our skin. So if you want to get further information about the disease, you can refer the reference that I really insert inside the poster. That's all from